Rubber dam isolation. In this video, we are going to see the various rubber dam isolation techniques here with the armamentarium, and you start isolating the area by marking the teeth which needs to be isolated. So for me, always I mark it on the corner of the right hand corner of the rubber dam sheet so that when we tend to remove the rubber dam sheet to take an X-ray so that it will be easy for me to reposition it. So once we mark either as for a quadrant or a single tooth isolation, once the mark is done, we'll punch that particular area which needs to be isolated. Before we start the rubber dam placement, we need to check the contacts by doing a interdental flossing. So once the flossing is done and cleared the contacts, then we need to check the clamp placement. So this is something called as a stability test. So we place the clamp over the teeth which needs to be isolated. So gently rock the clamp whether it is stable and it has a 4-point contact with the help of all the prongs. So this stability test is passed. Then we'll go to the first technique, the dam before the retainer. So which is a single tooth isolation technique. So to place the rubber dam sheet in an easier way, I'll apply a lubricant on the tissue side and gently slide the rubber dam into the tooth which needs to be isolated. So once it is done, the selected clamp will be placed to ensure the contact and the stability over the tooth needs to be isolated. Then after that, stretch the rubber dam sheet, especially on the corners initially, to stabilize the sheet in the rubber dam frame. Then once it is done, you can do the complete isolation. The tooth is getting completely isolated from the rest of the jaw. So the next technique is dam after the retainer. So again, normally we can use either a wingless clamp or winged clamps. Here, I prefer to choose a wingless clamp because when we stretch the sheet, so that we need no need to overstretch the sheet over the bow of the clamp and even the wing area. So once we check the stability test, slide the rubber dam sheet into the bow and stretch it little mesially where the teeth needs to be isolated and bring it down and position it and ensure that it reaches the below the contact region. That's why we need to floss before placing the rubber dam, either for a single tooth or for a quadrant isolation. So that's the importance. That's why in the initial video we saw I was flossing the contacts. Again, stretch the sheet over the rubber dam frame and position it. So there are either way you can place the frame underneath or you can place above the sheet also. So normally I do prefer placing the frame beneath or underneath the sheet. The next technique is dam and retainer together simultaneously. So stretch the punched hole and position the sheet over the clamp, and you have to see visibly the punched area. So this is how it looks, and I'm rechecking it by inversing it and seeing it. Then carry the rubber dam and the clamp together with the help of the forceps and position it on the tooth. And I simultaneously I check the stability too. And now we can see it's not sealed completely. So the missing thing is I didn't, yeah. So now we are just releasing the rubber dam sheet from the wing. Now we can see the complete isolation where we cannot see the tissue around the cervical area of the tooth. So gently after placing it, after doing that, Gently rock the clamp so that it will be more stable and the sheet will be positioned perfectly. Here I'm using a plastic frame to secure the sheet. And I always prefer winding the floss from the hole and pass it around the bow of the clamp so that we can secure the clamp to, in case if it fractures, we can snap the clamp from the mouth so that we can prevent the accidental swallowing of the broken part of the clamp. Now we saw all the three techniques of single tooth isolation. So while removing the rubber dam, so first thing is, in a single tooth isolation, we'll remove the clamp first. Once the clamp is removed, then gently release the rubber dam sheet along with the frame, or you can remove the frame first and release the sheet later. Next comes the quadrant isolation. So the contact area is checked before, and so we saw it is already punched and kept it ready. So we have to stretch the sheet more labiolingually, and wherever the area where the sheet is not gone below the contact, with the help of the floss, you can floss and push the sheet below the contact and secure the sheet well. Additionally, either you can use your dental floss to tie around the cervical area of the tooth. There is a special knot for it. We have to learn and tie the floss. As a beginner, I would rather suggest to use a wedges first, and most distal area you can place the clamp and secure the sheet, and in between you can use the wedges and place the wedges in the interdental, I mean in the embrasure areas, gingival embrasure areas, and secure the sheet firmly in the cervical part of the teeth. And this is something called as inversion. So we have to use a special instrument and pass it around the collar of the neck, that is in the near the gingival sulcus. So it can be done either this way or gently blow an air near to the cervical region after doing this. After that, finally, you can place the wedges. You can even customize the wedges by using a elastic cords, which is available in a surgical glove. So once this is done, then secure the sheet over the frame, and we have secured the clamp with the help of the tying the dental floss around the bow, so that in case of any accidental fracture of the clamp, the accidental swallowing will be avoided by snapping the clamp broken part by pulling the string of the rubber dam, I mean clamp. Thank you.